Hello Professor, my name is Joel and today I'll be performing assessment on heart and blood vessel, and this is my patient. His name is David. To start with the assessment, firstly I would like to sanitize my hand. After sanitizing my hands, I would like to ask the patient few questions and then proceed with the assessment of blood vessels. So David, I would like to ask you a few questions like, did you ever had a heart attack?
No.
So did you ever had any procedure like induction of any stuff?
No, I don't know.
So okay, that's good. And did you ever had experiences like chest pain?
No, never.
Okay, that's great. So thank you. To start with the assessment, I would like to ask David if he can take a supine position. For supine position, he need to lay down flat on the bed, and I need to remove the pillow. And for the assessment of the blood vessel, so what I need to do is, for the neck vessel, I need to make sure that the patient is facing towards the other side. So, and then I need to assess the blood vessel, and usually this is the jugular vein. In patient which is abnormal, this jugular vein is usually palpated or bulgy and popping out. But in the patients like which is normal, like David, the vein is very hard. It's normal, so which cannot be seen or cannot be assessed in the normal patient. But in usually the patient suffering with the cardiac diseases, it's usually sometimes the patient might be the blood vessel is popping or it's very bulgy rather than straight. So that is the first indication that patient might be suffering from the cardiac disease. And for the next step, I need to make patient sit. So I would like to ask David if he can sit, and I will be assessing his carotid pulse. For assessing the carotid pulse, I need to put my fingers across the trachea, just above the middle of the neck, and I need to count how the carotid pulse is. For the carotid pulse needs to be very pulsating, not very pulsating, but should be regular and average. It should be like +2, and I need to assess from both the sides so that I can make the better judgment of what's his carotid pulse saying. So in patients like David, who is not suffering with any cardiac disease, he is normal. But in sometimes if the patient with suffering has an history of like cardiac diseases or like blood vessel disorder, the pulses are usually very hard and rigid, and the pulse is very pulsating, which is an early indication of the cardiac disorder. So now I'll be moving to the assessment of carotid artery. So assessment of the carotid artery can be done with the help of stethoscope and by using the bell portion of the stethoscope. And for doing the assessment, I would like ask David if he can take deep breaths. So David, can you breathe in?
Yeah.
And then breathe out, and then hold for a second. Then I'll be doing it on the other side too. So breathe in, breathe out, and hold. So it's normal, but in the patient suffering with the carotid disorders or the cardiac disorder, it's usually the artery is usually squishy, and that's an indication whether the person is suffering with any deviation on the normal sign or not. Now I'll be moving to the assessment of the chest. For assessing the chest movement, what I need to see if there is a proper respiratory movement and proper chest movement, and there is no sign of any pulsation or extra pulsation, which is which signifies any cardiac disorder. But in the patient like this, like David, since he is not suffering from any cardiac disorder, so he shows just the normal respiratory movements. And moving on to the assessment of the heart with the help of the stethoscope, I'll be assessing the aortic region, then pulmonary region, then fifth intercostal muscles, and then the mitral valve. So what I'll be doing with the help of the stethoscope, I'll be trying to hear the sounds, and which will be probably a normal sound. But in the patient with cardiac disorder, the patient might have a clicking sound or the murmur sound. So this is the aortic region, and then I'll be moving on to the pulmonary region, and then to the fifth intercostal space, and then to the mitral space. since all I can hear is just the normal sounds like S1 and S2, so I'll be performing the same thing with the help of the bell region of the stethoscope. So what I could hear is just the normal S2 sounds and no sign of any murmur sound or any clicking sound. So this was all about the assessment of the heart and the blood vessels. So thank you.